Khayal cap, wind attacks. Khayal cap, sometimes called wind attacks, is primarily seen in Cambodian populations and is deeply tied to cultural beliefs. It's similar to a panic attack but with a twist. Those affected believe a wind-like substance is rising inside them, causing dizziness, shortness of breath, and other symptoms of anxiety. This belief can be so strong that it adds a layer of fear, specifically the fear of death from internal dysfunction. People who have experienced significant trauma, such as Cambodian refugees, are especially vulnerable to this condition. Kufungisisa. In many parts of the world, worrying or thinking too much can be considered a cause of illness. In Zimbabwe, kufungisisa is exactly that, an expression for thinking too much. It's more than just a saying, it's a recognized mental health condition. Those affected by kufungisisa often experience symptoms like headaches, chest pains, and fatigue, all linked to constant rumination. This condition is tied to the belief that excessive thinking can damage both the mind and body. Clinical lycanthropy. Clinical lycanthropy is one of the more fascinating mental disorders, as it involves the delusion that one can transform into an animal. While the myth of werewolves is widely known, clinical lycanthropy is a real psychological condition where individuals genuinely believe they have transformed into wolves or other animals. During these episodes, they may even behave like the animal in question, mimicking its movements or making its sounds. The condition is rare and often tied to other psychiatric disorders, such as schizophrenia. Depersonalization. Depersonalization and derealization are closely related experiences where a person feels disconnected from themselves or their surroundings. Depersonalization involves feeling like you're outside your body, watching yourself as if you were a stranger. Derealization, on the other hand, is the sensation that the world around you isn't real, as if you're in a dream. For those with depersonalizations, these experiences aren't temporary. They persist and cause significant distress. It's a condition that can make people feel profoundly alienated from their own lives, blurring the boundaries between reality and imagination in disturbing ways. Diogenes syndrome. Diogenes syndrome is named after the ancient Greek philosopher who famously rejected societal norms, living in extreme poverty. People with this condition, however, don't choose to live this way. They're often elderly individuals who suffer from compulsive hoarding, extreme self-neglect, and social isolation. These individuals may live in unsanitary conditions, hoarding everything from old newspapers to broken appliances. This syndrome is often associated with dementia or other cognitive decline. Stendhal syndrome. For most people, art is something to be enjoyed, but for those with Stendhal syndrome, art can be overwhelming. Named after the 19th century French author Stendhal, who described feeling faint and anxious while viewing beautiful artwork in Florence, this syndrome involves physical and emotional distress triggered by exposure to art. Those affected may experience dizziness, panic, or even hallucinations when confronted with particularly moving pieces of art. It's as if their mind and body can't handle the intense beauty or emotional significance of the art in front of them. Apotemnophilia, BIID. Apotemnophilia, also known as body integrity identity disorder, BIID, is one of the most puzzling and controversial mental health conditions. People with BIID feel an overwhelming desire to amputate one or more healthy limbs, believing that these limbs don't belong to their body. Some may go so far as to damage their limb in an attempt to force its removal. The cause is not well understood, though some researchers believe it may be linked to abnormalities in the brain's parietal lobe, which is responsible for processing body image. This condition is difficult to treat because many sufferers do not seek help, as they view the amputation of their limb as a solution rather than a problem. Alien hand syndrome. Alien hand syndrome is a rare neurological disorder in which a person's hand seems to move and act on its own, independent of their will. The hand might grab objects, undo buttons, or even slap the person, all without their conscious control. This disorder often occurs after brain surgery or injury, particularly to the corpus callosum, the part of the brain that connects its two hemispheres. For those with alien hand syndrome, it can feel as if their hand belongs to someone else, creating a strange and unsettling sense of disconnection from their own body. Capgras syndrome. Capgras syndrome is a rare but particularly disturbing delusion in which a person believes that someone close to them, such as a spouse or family member, has been replaced by an identical imposter. This condition is often seen in patients with schizophrenia or after a traumatic brain injury. People with Capgras syndrome may become paranoid and suspicious, avoiding or even becoming hostile toward the person they believe is an imposter. It's a frightening experience, not just for the person suffering from the delusion, but also for the family members who are being misidentified. Alice in Wonderland syndrome. Finally, we have Alice in Wonderland syndrome, a condition that distorts a person's perception of their body, time, or space. Those with AIWS may feel as though parts of their body are too large or too small, or that the room they're in is shifting in size. These distortions can cause intense confusion and fear, making it difficult to trust one's own senses. AIWS is often associated with migraines and can also be triggered by certain drugs or brain injuries. The condition gets its name from Lewis Carroll's famous story, where Alice experiences similar distortions after falling down the rabbit hole. While it may sound whimsical, AIWS can be deeply disorienting and frightening for those who experience it.